Hello everybody. If you are following this clip, this means that you are interested in what MedLang project has to offer. This means that you are perhaps a student in medicine, or perhaps you are already working in the field of medicine, or you may be perhaps a member in a family that has a patient that faces terminal disease and the fatal ending. Perhaps you are a member of a community of volunteers, or you are in a company that is interested in social corporate responsibility. MedLang addresses all these categories and many others, addresses the community at large. MedLang is a very interesting project because the 4 countries with 9 partners, many of them higher education institutions, will offer a first in their teaching methodology. They create a massive open online course on palliative care. Palliative care is something that concerns everybody. Everybody may have in their family somebody who suffers and is bedridden and has no hopes for the future. This means that medicine at large needs to offer help in an international way, in a standardized format, and with tools that mean the same thing to everybody. The massive open online course which this project creates and which covers the field of palliative care, in fact promotes, standardizes and recognizes medical tools that are created as a result of a very thorough medical research in the field of palliative care. 20 protocols are created in this project. This is much, this is less, this is more than nothing, we would say, because they are the result of a very specialized and expert analysis offered by the medical researchers in the project, and they cover a very interesting methodology because the protocols are accompanied by films that illustrate and simulate the kind of operations, work, investigation and activities related to the implementation of the protocols in the medical field or outside the medical field at home by people who are not necessarily medical specialists, but who are faced with a family member who is bedridden. The project offers a very interesting connection between the world of education and the world of work. The project also addresses a multidisciplinary trait because it focuses on medical content, but it also focuses on communication in various languages and on language training as well. You may wonder how this is possible. The films and the protocols, they also offer very rich, stimulating, energizing material for teaching communication in various languages for medical students. It is a common fact now that the medical profession travels all over Europe, all over globe. They need to communicate in a standard format that is understandable to their medical peers, but to their patients and their families as well. From this point of view, communication includes not only the lexical words, grammar and content, but it also offers cultural information and traits. And the films and their processing in terms of communication and language training focuses and offers consolidation and training and practice in communication in different cultural contexts. The international dimension of training as a format of creating opportunities for job development is also consolidated in the process. There is a permanent exchange, flow and co-creation of knowledge among the higher education institutions in the project, but at the same time a lot of feedback and support offered by the businesses which are partners in the project and by the hospital, who is the piloting and testing ground for the project results. In conclusion, we invite you to visit the MOOC, be the first students who enroll in the MOOC created by the project, the massive online open course on palliative care. And we would appreciate very much any feedback that comes from the people that are the first volunteers. Thank you very much.